how do you know when to call for backup? The airway's not going as you planned? It's time to call. The vital signs are decompensating faster than you can fix? It's time to call. I'll tell you a story that happened to me many, many years ago. So one night it was the charged CRNA, everything was on fire, and I had this emergency vascular case coming down. My only free person to handle it was a new to practice CRNA who was very clinically good, but a few minutes into the case, maybe like 30 minutes in, he called me asking me to bring in more phenylephrine. But since I had set up the room for him, I knew he must have been running the phenylephrine at a pretty high rate to already be running out so quickly. So my spidey senses kind of went up. I asked him if the patient was bleeding. He said he already talked to the surgeon. There was no visible blood on the drapes or in the suction canister. And the surgeon said no, like the surgeon didn't think any bleeding was going on. So he didn't really know what was happening. And his attending anesthesiologist was like tied up in another room. So I said, okay, that doesn't really make sense. I spoke to the surgeon myself and I was like, hey, this patient has to be bleeding. And he was like, no, he's definitely not. I said, you need to stop what you're doing and look on fluoro because we were running phenylephrine at a maxed out range and our blood pressure is still in the toilet. Something is going on. Sure enough, there was a massive iliac artery dissection causing bleeding into the body. So I immediately called for anyone with free hands to come right away. We sent labs, we started hanging blood. This patient actually ended up coding from hyperkalemia, but we were already acting on it. We were already drawing up the insulin and the calcium. So after a round of CPR and giving all of our drugs, we actually got it back and the patient did okay. The moral of the story is if you are at the edge of your comfort zone and you're just not 100% sure what's next, just call. If you call for help and you didn't end up really needing it, the worst case scenario is you feel a little dumb, but waiting too long is when bad things happen. So as soon as your spidey senses start tingling, as soon as you're just not 100% sure what's going on, it's okay to phone a friend. It's okay to ask for help. It's okay to ask for a second set of eyes on the situation. Calling for help is not a sign of weakness. It is professionalism. It is what we're required to do to take excellent care of our patients. And every single person calls for help throughout their career, even the most experienced and intelligent practitioners.